Welcome to Health Watch, presented by Novant Health. I'm your host, June Baker. Our show features local health professionals discussing health topics of importance to local residents. Today we will be talking with Dr. Jeffrey Coury of Coastal Carolina Ear, Nose, and Throat about balloon sinuplasty, a new procedure being offered at Brunswick Community Hospital. Also, we have Mary Fogel, one of the dietitians at Brunswick Community Hospital, speaking with us about nutrition and how to lose those last few pounds before summer. Stay tuned to learn about valuable health topics with Health Watch. Our first guest is Dr. Jeffrey Coury of Coastal Carolina Ear, Nose, and Throat. Welcome, Dr. Coury. It's a pleasure to have you back on the show again.
Thank you.
Now, for those viewers who haven't met you yet, would you share some information about your education and your background with them?
Sure. I originally grew up in Scranton, Pennsylvania, and I did my undergraduate work at the University of Scranton, and then moved to Philadelphia for 9 years, where I did medical school at Philadelphia College of Medicine, and then 5 years at Hahnemann University, and then moved down to Whiteville, North Carolina 4 years ago.
Great. Well, what exactly does an eye, ear, nose, and throat physician do?
It used to be eye, ear, nose, and throat, and then about 10, 15 years ago, the eyes actually got pretty subspecialized, so then we actually separated, but it is one of the oldest specialties. So now we're ear, nose, and throat, and our technical name is otolaryngology, head and neck surgery, facial plastic surgery. So we do quite a bit.
That's a big mouthful.
And it is. And we do general surgery for 3 years, and then we specialize in 3 years for ear, nose, and throat. And we do a wide array of problems, and we deal with kids, so we do tonsils, we take out the adenoids, we place tubes, we deal with kids who have hearing problems, neck masses, kids who have allergies, we deal with them as well and do sinus surgery and treat them for sinusitis. Regarding the ear, with adults, we deal with chronic ear infections, people who need hearing aids and hearing tests. Nose, obviously, we deal with allergy and sinus issues. Throat, we deal with sleep apnea, patients who are surgical candidates for sleep apnea. We do operate on the nose to straighten out the septum and operate on the throat to take out the tonsils and tissue in the back of the throat to help them breathe better.
Wow. That's a lot.
It is.
Was there something that inspired you to choose this specialty?
The specialty itself is very intriguing. The anatomy of the head and neck and the ears, nose, and throat is very intriguing, and it's a nice mix of office hours and surgery, and we get to see a wide variety of ages from young to old.
Well, tell us about your practice here in Brunswick County.
Sure. I moved to Whiteville, North Carolina 4 years ago, and I joined Coastal Carolina Ear, Nose, and Throat, and I began to work with Dr. DeMuzio and Dr. Kenyon. We opened up a small satellite office down at Seaside, and we stayed there for approximately 2 to 3 years, and business started to boom. So then we decided to move closer to the hospital when I got on staff at Brunswick, and now we have an office in Charlotte.
Well, today I want to talk to you about sinusitis and that new procedure that I understand you're doing at Brunswick Community Hospital. But first, tell us what sinusitis is.
Sure. I think it's a good idea to explain why we have sinuses and what the sinuses are first. So, the sinuses are holes in the skull, and they're lined with a lining much similar to the lining in our mouth. And that lining has hair cells, and the hair cells basically transport mucus and bacteria that get trapped in the nose out of the sinuses through little holes called ostia, or exit holes. Once in the nose, the bacteria gets swept down to the stomach where we digest it. So that's one purpose of the sinuses. The second purpose is so that it lightens our skull so we're not walking around with a 40-pound head. And also it affects resonation so we can speak louder, more effective resonation. And sinusitis is any type of inflammation that inflames the lining of the sinuses that causes pain and pressure, and that lining that surrounds that hole or ostia gets closed shut, and that causes the symptoms of sinusitis.
And the symptoms are, again?
Pain and pressure over the sinus region, such as the maxillary sinus, the cheek area. Near the nose, that's the ethmoid sinuses, the frontal sinus on top of the skull. It causes pain, congestion, postnasal drip, and in the acute phase, pus, nasal congestion, and occasionally a fever. Once the acute phase is over, some patients experience chronic sinusitis, which is a lingering symptom like postnasal drip or a cough or continued facial pressure.
I understand that sinusitis is one of the most common chronic health problems in the United States. Is that correct?
That is correct.
Wow. What are some of the causes of sinus trouble?
Well, anything that infects the lining and inflames the lining can cause sinusitis. So pollutants, allergies, viral infections, and especially bacterial infections. Some people also have alternate anatomy where if they've gotten hit in the nose where they're younger and have a deviated septum, which is the midline of the nose, that can crunch the sinuses together and make those holes naturally smaller. So that sets them up for a sinus infection just in case a virus or a bacteria enters, where if it swells slightly enough that it would close off the hole in those patients who have anatomical problems.
Well, you mentioned allergies, and I know I have a lot of allergies. What part does that play in the sinusitis?
Well, an allergy is a response to something that's normal in the environment. So trees are normal, grass is normal, dogs and cats. But in patients who have allergies, they're hypersensitive to these chemicals. So for instance, pollen. If a patient is allergic to pollen, the pollen enters the nose and enters the sinus. And basically the body goes haywire over and tries to wall it off. So the lining gets inflamed, the mucus gets thick, and it tries to trap it. Unfortunately, when it traps it, the lining gets tight again, that hole gets tight, you get pain and pressure, bacterial infection can ensue, and then you have sinusitis.
Okay. What are some of the preliminary treatments for sinusitis?
Well, it's normal for people to get sinus infections 1 to 2 times a year. And initially, if a patient is in the winter time and they're around sick people and they get a sinus infection, they go to their primary care doctor and he evaluates them. If they have a viral infection, sometimes he'll give them nasal rinses and nasal steroids to get them over that period. If he thinks it's bacteria or allergy, he'll treat them accordingly. Sometimes he'll give antibiotics, and usually a short course will take care of it, about 10 days. Nasal rinses and nasal steroids help, as well as neti pots and saline. So most people do get better with that treatment. Some people need to come back to the doctor if they continue with their sinus infections, and then they receive maybe another course of antibiotics or a longer course. And if it continues, then the primary care doctor thinks there's something out of their realm and decides to send them to me so that I can take a good look at them. And when I see them in the office, I see what antibiotics they were on, what nasal rinses they were on, and see what the cause is. If the cause is allergic, I'll treat their allergies. If the cause is bacterial, we'll treat them with the right appropriate antibiotic. I'll do nasal endoscopy in the office to rule out polyps or any type of septal or deviated septum that they have, and see if their sinus ostia are actually open. If I think they need a CAT scan, I'll get them a CAT scan so we can take a look deeply into their sinuses and see if actually the infection has cleared out or if that lining is still continued to be thick, that maybe those patients can be surgical candidates.
Well, I understand that there's a relatively new procedure called balloon sinuplasty, and I was wondering if you could talk to us a little bit about that procedure and how it works.
Sure. The procedure takes approximately a half an hour or an hour to do. It's done at the hospital, at Brunswick Hospital. The patients receive general anesthesia so they don't feel anything. And initially, I look in the nose with an endoscope, which is displayed on the screen so I can take a good look at their sinuses in a blown-up view. I find where their sinus natural hole is, and then I enter the sinus by using a little lighted guide wire. So once the guide wire enters the sinus, I can see the sinus transilluminate on the skull, and that confirms placement. Then I take a catheter and place it through and over the wire into the sinus hole. The catheter is blown up, and a balloon appears and basically microfractures and remodels the bone, remodels the ostia. So there's no tearing of tissue, there's no significant bleeding. The bone is actually fractured and it's remodeled, and it stays that way. I remove the balloon and the ostia or hole is nice and open and allows the sinuses to drain better.
Wow, that's exciting. What's so different about that procedure as opposed to some of the older ones?
I think it's a good idea to take a look at the evolution of sinus surgery, because everybody thinks back to the days in the 60s and 70s and 80s where a lot of bleeding occurred and the procedure took 2.5 hours and terrible pain afterward and congestion and scar tissue. So initially in the 60s and 70s, they didn't have endoscopy, which is a camera that they can insert through the nose. They basically did it by looking through the nostril and taking cutting instruments and punching holes into the sinuses to see if they would drain. This resulted in a lot of scar tissue, long recovery time, congestion, bleeding, pain afterward. Sometimes physicians would put gauze in the nose, which was up to 6 feet long on each side. And those are the horror stories you hear.
Right.
10 years later, they came up with the endoscope, and the endoscope allowed us to take a look in the sinus in a blown-up view so we can see precisely where we're going. We still had to use cutting instruments to enter the sinus, so it still created some scar tissue and some closing of the sinus holes, some bleeding, and some time off from work, at least a week or two, and significant packing.
Right.
5 years later, they came out with powered instrumentation, whereby at the end of the tool, there's a little cutting device, so it's very precise. So it cuts the sinuses open, but it still results in some tissue loss and bleeding and congestion and some pain afterward. And nowadays, Clarent, which was the company recently taken over by Johnson & Johnson, came up with a balloon sinuplasty device to basically open the sinus in a way not to tear the hole, not to cause scar tissue, significant bleeding and packing. It basically remodels the bone, fractures the bone outward, and it holds. So this obviates the need for significant packing in the operating room. Patients don't really have a long recovery time. They can expect at most 3 to 4 days of missed work time, and they don't have significant pain afterward. So it's a nice, quick, easy procedure where they can get relief from their sinuses.
Yeah. Well, it sounds like there are a lot of benefits then to this new procedure.
Sure is.
But I'm sure there are folks out there wondering, well, what are the risks or what might be the complications? Can we talk about that a little bit?
Sure. There's always risk to a procedure. And the most common risk to balloon sinuplasty is bleeding and infection and pain after the procedure. But years ago, you hear the horror stories about people who had black eyes and the brain is nearby. They get leaks of fluid from around the brain. So that's basically obsolete with the advent of the balloon sinuplasty system and endoscopy. So there are risks to the procedure, but it's mainly bleeding, infection, and some pain after the procedure.
Are there specific patients who would benefit more from this surgery? Are there certain patients who do better than others?
Well, you have to qualify for the procedure itself. And if you get 1 or 2 sinus infections a year, you may not qualify for a surgical procedure. But if you can't get relief from your sinuses with maximal medical therapy, and if the CAT scan does show inflamed sinuses and inflamed sinus ostia or exit holes, then you'd be a candidate for the procedure. Patients even with nasal polyps will be candidate for the procedure as well. Still, we have to remove the polypoid tissue with those powered instruments. But after that's removed, we can still open up the sinuses with the balloon sinuplasty device.
So for a patient who's considering having the balloon sinusplasty, what should we expect after that surgery? How are we going to feel, and are we going to be able to breathe much better? And
oh, sure. Patients generally get general anesthesia, so it's done at Brunswick Hospital. They receive general anesthesia for about an hour or so. Once I open up their sinuses, they go to the recovery room. They're a little out of it because of the general anesthesia, but they go home within 2 hours. Typically, my patients take some pain pills, usually about 3 or 4 pain pills after the procedure. If I have to fix the septum, then nasal packing is required, but it's small. It's only about 1 inch long, and it comes out in a few days. So most people do quite well and can resume their normal activities in 2 to 3 days.
Well, I know it's a new procedure, and I'm curious, have you done a lot of these procedures?
Yes, I have. I actually started doing balloon sinuplasty 6 years ago when it first came out.
Oh, I see.
So I was the chief resident in Philadelphia, and I had the pleasure to work under one of my mentors who started using balloon sinuplasty quite a bit. So I used that basically for the last half of my residency. And then I actually went to Maryland to receive a training course right before I moved down here on balloon sinuplasty. And thankfully now we have the technology at Brunswick Hospital. We've been doing it since September.
Wow, that's great. That just sounds so interesting. It sounds like it's going to be real helpful for those of us who have sinus trouble in this area. For our viewers out there, what's the best way they can contact you if they would like to schedule an appointment?
Sure. We have 2 offices. My first office is in Charlotte, and that's 910-755-3682. If you need to get a hold of us through the Whiteville office, that's 910-914-0540.
Great. Well, thank you so much for joining us today. It's been very, very interesting.